again. Now, earlier this morning, as I record this on the 27th of March, we had our long-form Things You Might Not Have Heard show, and we had a story that was been a couple days in the works talking about some layoffs coming to the all the folks under the HHS that he's directing, especially for CDC and NIH. What about 2,800 employees between the two agencies? Breaking news as I'm literally cutting it up, prepping to putting in the feed for a little bit later for extending on the stories. We have a new number, 10,000 full-time positions being cut under HHS by Secretary Robert F. Kennedy Jr. This is very fresh news and maybe not so clean, but I'm going to read through what the robot editor has given to me in a couple stories that have been released so far. And if things seem a little whack, I may talk about it in real time, but it's a very long recap of what exactly is coming down on information that's only been essentially, as I'm recording this, out there maybe 30, 40 minutes in real time, and on the anchors breaking into it, probably about 20 minutes or so. Now, the restructuring is going to be a serious workforce reduction. It was supposed to be smaller agencies with many people already being fired, but right now the target went from a smaller number in the thousands to the 10,000 employees all over HHS interior, including those responsible for critical functions, disease outbreak response, drug approval procedures, and administration of health insurance programs. Essentially, all across the board, everybody's looking for more people to be cut coming soon. 5 out of 10 regional offices are slated for closure, with operations being consolidated to enhance those efficiency. A centralization of services for administrative function, including communications, procurement, human resources, information technology, and policy planning, will be centralized. The move is expected to significantly alter the operations and dynamics of the major health agencies, such as the CDC and CMS, the Centers for Medicare and Medicaid, also Food and Drug Administration. Essentially, this consolidation, bringing people in one central hub and working out that way. Didn't work that well for broadcast, trust me, because that's why I'm no longer in broadcasting. No more actual opportunities. We'll see how it's going to work going forward with this one, because it's happening. The initiative is following the voluntary departure of about 10,000 people off the front end from HHS since he being Donald Trump assumed the office, and trying to eliminate other jobs. But this is 10,000 on top of the 10,000 going forward. Looking for a total reduction of about 25%, leaving about 62,000 federal workers still in the process. But the questions will remain on who's left, how good are they, whether they're actually good or not good, and how good are they at adapting to more work. The problem that always happens with disappearing people in the workplace is that the work that they were doing doesn't disappear with them. So someone has to pick up that slack. In most cases, it's not picked up in a shared capacity that makes any sense. It's usually if there's 3 people sitting in a workplace and one person disappears, one person takes on 2/3 of the work and the other person will sort of do the other third until the other person ends up having to do it all on its own. And it turns into a serious mess until you think you have to hire more people because the workload's unbalanced. But since you got rid of all those folks in the first place, you can't. What does this actually mean? And I wish I had actually answered to that question, but what does this actually mean? I know from a standpoint of literally studying businesses for the bulk of my lifetime, since being a middle teenager, on how things work, that this is one thing that is used by businesses to clear a budget sheet to make sure there's available cash on the balance to be looked at, so it looks great for a while, and then the companies have to figure out what to do going forward, and hopefully they can pull themselves out of that jam and eventually hire back more people when things are more profitable. The government does make a profit, so it's not about, if we're making extra money, if we can add more people to this deal, we can make more money in context. It's, we need these folks to do this job. We have a budget to do this. We'll bring these extra people in there so we can actually functionally get this job done, and we'll deal with the shortfalls later. That's how the government sort of works. They'll do things to raise money. They'll add, taxes and, sales taxes and sell bonds and things like that. That's how local governments will do. That's why you have so many sales taxes that show up on the books. And then after the time expires for what they're used for, they find a way to rejigger it so it can stay on the books so they can keep paying some more folks going forward. If this is already there, it's easy to keep it there. But that's not what we're doing with these government cuts and the DOGE stuff. Now, the Department of Government Efficiency is not so much changing the processes. They're saying, hey, these are old computers you need to get rid of. So let's just shut them down, throw them away, and put in this new box over here. Just ignoring the actual data that's on there, or the people that use those computers, or the jobs of people that they're getting rid of in a market where, now that there's more tariffs and more issues in the actual marketplace of people making jobs, there are less jobs to look for, and there's less jobs in the government to shoot for, which are normally seen as great jobs to get people out of this level of poverty, move them up the working class well so they can pay more taxes. Because the goal is actually to pay a little bit more in taxes because that means you're making a little bit more money. That's kind of the actual goal to do things. Now, what does this mean for all of us going forward? As far as health and human services, things are going to get a little bit crazy. I'm not going to say worse. Let's just say crazy, as the reorg means figuring out who needs to do what, how it'll get done, and where you'll get it done from. Your agency, your office, your agent will probably no longer be there, and they may be in another building down the street, maybe in another building in another district, or you have to get them by phone or by online. And if they cut some of those services, less people answering phones, more wait times. That's what it comes down to. More wait times, more times to get things processed, more time to get things worked on, more time to have scientists work on things to try to learn stuff and get on things, more time to do basic paperwork. Eliminating people, eliminating staff usually means less on the way of efficiency, but more in the way of time getting things done, because maybe the people that are left behind are more efficient. They are now doing 2, 3, 4 people's jobs that they weren't doing before. So that does not make it all that greater in the timeline. Robert F. Kennedy has things against health and human resources. He had things against services, I should say, things against vaccines, things against health care, and has a lot of grand ideas that he gets a chance to speak onto because he has all those degrees. He's a scientist, and he has a very famous name. Although the people who share his name and also try to share that legacy tend to shun him, both as a family member and, of course, as a person of stature. So you have that to worry about. But if you're a person that thinks that he's just being railroaded, his family has gone woke and got caught in something, and so they're not listening to truth, actually listen to what's being said. Argue with me all you want to. That is fine. Complain about what I'm saying you want to. That is fine. But don't do it until you've actually listened to the entire video, or read the entire article we're linking to this here, or actually taking some time to look at more than one source in the source, not just the one source this past week that's been glossing over the biggest story in the nation, but not saying that it was a good thing or bad thing, but saying like, it's no big deal, when it kind of is a big deal. Give me your comments. Give me your thoughts. This is a much longer run through because this is a full change to what's going on. But 10,000 full-time employees will be disappeared from HHS fairly soon to do whatever it is that's the bidding of President Donald Trump in this manner. Who they are, to be determined. But when I reported this morning, we're looking at 2,900 people that were being taken place in mostly 2 agencies that were said to be bloated, and we could kind of work through that one. Now across the entire board, 10,000. That's a lot of people out of jobs, and a lot of work that needs to be picked up by other folks that won't be picked up as well because they're doing 2, 3, 4 people's jobs. Comments, let me know. Say what you want to say. We need to talk about this.